Hey YouTube, so it's been a little bit, so I thought I would do an update. I've got really exciting news. I decided to do plastic surgery. I was hoping, because of how low my stomach hangs, to get it covered by insurance, but when I went, it can be covered by insurance, but the thing is not much would be cut off. And to go through that and not have, you know, all of it cut off, I guess, and to go through that pain is just like, well, it just really wasn't worth it in my mind. So I decided to take out a loan and pay it off and kind of get off, you know, the major parts of my body that I struggle with. You know, I do have loose skin on my arms, on my legs, but that doesn't really bother me. It's mainly my stomach because it hangs so low and it stretched my belly button so far down that the thing that insurance covers, appendectomy or something like that. I always get the name wrong, but it's below the belly button that they cut off because they don't touch anything at the belly button or above. And since my belly button hangs so much lower than a normal belly button, that's why I say not that much would get cut off and I would still be left with truly a lot of skin. So, but the appendectomy, you know, it's like, it's covered if you have rashes and skin irritation from the fold of your hanging stomach, which I did have. So the insurance would cover it. But like I said, it just, for being cut from side to side and going through that pain and not having, you know, I'm not going to be a Barbie doll, and I'm okay with that. I really am. But I don't want to go through that pain and still have so much left. So I've decided to do plastic surgery, and it's actually going to be on Wednesday, which is 2 days away because this is Sunday, and I'm super, super nervous. We get 2 weeks off of school for Christmas vacation, and that starts not this week, but the week after. And so I took off 3 days of this week to have my surgery on Wednesday. So I'll have like 2.5 weeks to recover. Granted, I know you have to wear the binder thing, that holds in your skin to help with retaining fluid. I know you have to wear that for 6 weeks, and you're not, of course, you're not completely healed for 6 weeks, but at least after 2 weeks, you're a little better and you can go back to work. It's definitely going to be hard because I work in special education. I have to transfer students. I have to, you know, teachers bend a lot, so I'm definitely stressed, but people say that they will help me. I haven't told many people, but I have told a couple, and they say that they would help me. So I'm hoping that it'll be okay. I really wanted to wait until the summer because I would have the whole summer to recover. But unfortunately, as a teacher's aide, we don't get paid in the summer. And I hopefully want to be able to be either a teacher or a job coach in summer school. And if that's the case, then I really wouldn't have, to be able to do that, I really wouldn't be able to have the surgery in the summer, because after summer school, there's only, you know, not that much time before school actually starts. So Wednesday, I'm super, super nervous. The closer it gets, the more my heart is just like fluttering. Am I doing the right thing? Am I emotionally ready for this? Because it's going to be such a huge thing. The doctor that, the surgeon that I went to, that's what his specialty is doing surgery on people that have lost a lot of weight. And with our support group, he comes and he talks, and he's done several people in the support group. So I know that it's a good surgeon. I've done my research, so I'm not so much worried about that. But when you hear that he's operated on a woman that's lost 210 pounds, and I've lost pretty much 200 pounds. So I'm not like the biggest person, like of amount of weight, but he did say I am the biggest amount of skin that he's ever removed. And he said normally the surgery is like 6 to 8 hours, and I'm going to be in surgery for 10 hours. So it's a little scary, but you know, I was really large when I had my gastric bypass, and everything turned out okay. So I'm hoping that it will be okay, and it will be a total big difference. I'm kind of hoping in the next 2 days I get the courage up to show my extra skin, more for myself than anything, to kind of document it, because I'll be honest, my surgery is $19,000, and I do not, seriously do not want to gain this weight back after spending that much money. And I know documenting it and seeing it where I can go back and see it will help me remember what the struggle was, and hopefully not go back there. I really hope. So let me tell you what I'm getting done. I'm getting done several things. I'm getting done the 360 body lift, which is all the way around your body. So it's like kind of like a tummy tuck in the front, and then I guess like a butt lift, if you would call it, because they tighten your butt muscles. I'm also getting a UBL, which is where they go from your belly button straight up, because I have an extra roll on the top that is pretty noticeable. Like with all my clothes, you can totally see it. So I didn't want to, of course there's a choice, you didn't have to do the UBL, but I was kind of like, it was only a couple more thousand, and I was like, to go through the 360 and then still have this upper roll, I might as well just do it. So I'm getting that done. And then also I'm getting, I guess it's called an upper back lift, but it's where like your top back roll gets taken off, and it's kind of where it covers by your bra. So your around will be, your bra size around will be smaller. I carried my weight all in like my torso. My legs and my arms have always been pretty skinny. Like I say, I have a little bit of jiggle, but really compared to other weight loss patients that I've seen, it's really nothing at all. Like I still wear tank tops and I still wear shorts, and it doesn't bother me because on my lower legs I have no extra skin, but of course on my thighs I have like a little bit. But so most of it has been in my stomach, and then of course there's some on my back. There's a pretty good roll on my back. But yeah, so I'm getting a lot done. I'm actually, usually people after 360 body lift only stay in the hospital for 1 day, and I'm staying in the hospital for 2. And it's also because of the amount of skin I'm getting taken off, because it's a lot. And so that's why I say I hope I am emotionally ready, because I'm definitely going to be a different person. And I am realistic in the sense, he did talk to me. He's like, you need to be realistic. You're not going to come out of surgery and be a Barbie doll and completely skinny. But he's like, I will do the best job I can. And he's like, I'm not looking at the time. I'm looking at safety, and I'm looking at what I can do for you, which I really do like that. And I really do think that's the truth because of the work I've seen him do on other people. But yeah, it's even though I'm not going to be a Barbie doll, it's like there's still going to be so much taken off. And it's so mind-blowing to even think about it, because I can't even like think about what I would look like without this huge stomach. And to talk about it emotionally, like all my life I've used my weight as kind of like a protection layer, so I wouldn't have to get hurt. And it's like the last layer is, you know, it makes my eyes tear up because it's really, it's the truth. And I think it is for a lot of people that we protect ourselves. We think we are protecting ourselves by having this weight, and the weight holds us back from people so we don't have to get hurt. And it's kind of like my last layer of protection is coming off, which I totally wanted to, but at the same time, it's so scary. It's still scary to like go through my closet and get rid of bigger clothes because I've been big my entire life, pretty much since I was like 6 or 7, somewhere around there. So to even like fathom or consider what I would look like without extra fat skin is just crazy. And I hope I'm ready. I mean, ready or not, I'm doing it. But I don't know. I definitely think I'm going to cry at surgery because it's so huge. Like, I've done all this work, and even though over this past year I've really, really struggled with things, I've still maintained, which is really a miracle for me because I've never just maintained. So I'm trying to look at the positive because it's hard when you still have so far to go and so much that you have to deal with that it's hard to see the positive. And so I'm trying, I really am. But I think it's definitely going to be emotional shock to me to see. And I think one of the harder things is my mom's not here for this because this is like a big, huge thing, you know, like I've succeeded and I've lost all this weight, which has, you know, burdened me my entire life. And she's not here to celebrate. You know, I've had so many wonderful things happen in my life over these past 2 years. And she hasn't been here to lift me up, to celebrate, to cry with me, to just to be happy for me. And it's really, I think that's one of the things I'm struggling with the most, because your mom is supposed to be the person who loves you. So hopefully one day, you know, I've been going to therapy ever since before weight loss surgery. Not that long before it. It was like a month or so before. And but I've been going to therapy for a really long time. That's a couple years. And over this past year, I've really just felt stagnant. Like nothing's helping. Nothing's, I'm just feeling the same. And, you know, my therapist is like, maybe that's what you need. Maybe you need to be okay with just being right now, because all your life you've been so burdened with things that maybe being okay with where you are is the best thing right now. So anyway, that's totally on topic but off a topic. But anyway, so back to plastic surgery. I'm super, super excited. And I hope everything goes well, and cross your fingers that I can gain that courage to show myself and others, because I know that there are other people that struggle with this. And then of course definitely after. So I thought I would update with that, and I will talk to everyone soon. Bye.